recognized use of the laser technology is within the periodontal pocket. And this has certainly become a topic of great interest, and it's a promising field of periodontal therapy. So why would we want to use the laser technology within the periodontal pocket? Well, for one, it's been FDA approved. And I was kind of surprised to see that it was approved as early as 1988 for sulcular debridement. And this is due to the diode laser's wavelength, where the diode's wavelength is around 810 nanometers, and it's safe to use near the dental hard tissue, where the CO2, which is around 10,000 nanometers, causes sometimes major thermal damage to the hard tissue. The second is that it's a very thin and very small instrument. It's only 400 microns, or 0.4 millimeters, and what that equates to is basically a lot less trauma than our conventional scaling instruments. The third is the hot tip fiber action. It's thought to do a couple of things. One, to decrease inflammation through the biostimulatory effect. Second, to vaporize this necrotic tissue that's found in the pocket. And third, to reduce the bacterial populations. So what does that all equate to? A result is a reduction in pocket depth over several weeks of healing, which is, of course, our goal of periodontal therapy. So here, well, there's a protocol that I put together. We use it here as an adjunct to our scaling, polishing, and our closed root planing. And the protocol was adapted basically from the human side. And you'll see here we set our pulse mode we set the machine on pulse mode at power about 0.8 to 1.2 watts, and it's 10 to 15 seconds per pocket. So you'll see on the distal aspect of this maxillary canine, it's about a 4 millimeter pocket there, maybe a 5. There I am setting the diode laser to 0.5. I'm going ahead and biostimulating that attached gingiva, just painting it back and forth. I'm going back and resetting the machine to 0.8. I'm inserting the diode fiber into the pocket and using a horizontal vertical movement 360 degrees around the tooth. Very simple, very straightforward. You guys are pretty advanced with what you do,
what symptoms
but
is she having?
in I think that really it could be used as an adjunct for any scaling, polishing, prophy case. So this dog came back about a week or so later. You can see I've inserted a probe, probably a little too hard. It's really blanched right there. And now we have about a 2 millimeter. So we've achieved maybe a 2 millimeter pocket reduction.